Welcome everyone to the first ever Midwest Music Foundation Summer Conference. Our first presenter today is Cameron Betts. He's going to talk about the Affordable Care Act.
Thank you. Thank you. Keep it down, hold it down. All right. No, thank you. Yeah, so Affordable Care Act and then some, as the slide clearly illustrates. So just to get started, and we'll keep this obviously informal. Agenda, who am I? Why am I here? Why did Scott ask me to come talk? It was because we took a moonlit drive in Los Angeles, and high on a hill overlooking downtown Los Angeles, holding hands. He asked me if I do this, and I said, sure, why not? I like it. And then I'll do my general health insurance disclaimer, talk about health insurance versus health care, get into the Affordable Care Act, again, very high level, and then tools, tips, and tricks at the end. But one of the things just right off the bat, this is just information. This is just presented in informal format. Health insurance is an emotional topic, it is a financial topic, it is a personal topic, and this is not meant to get into any of that. What it's meant to do is just provide information as opposed to, I got screwed by a hospital system, or this insurance is wrong. That debate is during drinks somewhere else, and I will gladly hop in. So to start off, who am I? This is my hometown. I don't live here anymore, but Kansas City is absolutely my hometown. I met my way better half, who hopefully is watching the streaming right now. Let's see, she's a much better person than I am, but met her here in Kansas City. We met at the non-dog park dog park, which is Westwood. We got married at the Liberty Memorial. I'm telling you all this just to show that I absolutely love Kansas City. This is where we bought a house and lost money. Kitty's, if you've ever had the tenderloin sandwich from Kitty's, then you know exactly where we lived. This is where I come out on the who's better, Bryant's or Gates. That's my answer to that question. Guiltiest of pleasures, if you know what that's a photo of, then you'll probably agree with me, and if you don't know what that's a photo of, then just go 2 blocks north to the Peanut. Core belief, just my wife and I, the thing that we instantly bonded on was just live music and always going to shows. So enough of that general stuff. What made it that Scott said, will you come and do a presentation? I went to school here. I have extensive years in the medical insurance industry in that building. Worked for an insurance broker for about 5 years. And then now I work for a company called, I won't even mention it because this is not an advertisement for anybody. I do wellness programs. I create health and wellness programs for companies so that employees can try to take proactive steps to just get healthier. Live in Los Angeles, it looks absolutely nothing like that, as Scott can attest. And my company is headquartered in Seattle, which actually looks exactly like that. It's a beautiful place. So here's my disclaimer. I don't sell insurance. I'm not here to make any money. I'm not here to sell anything, represent any company, anything like that. The reason why I really want to be here is I've been doing this for a long time, over a decade, and it's just kind of my way to give back to the people that do live music, present live music. And I'm one of the people in the audience buying the T-shirts, but this is and the CDs, but this is just a great way for me to do something on that end of it. This is an overview. That's exactly what it is. The first thing is health insurance versus health care. A lot of people get into mixing the two and saying, I never sought treatment because I can't get health care. Healthcare is a right, not a privilege. And I absolutely agree with the healthcare is a absolute right. When we start talking about this costs too much and I couldn't, get treatment because it's too expensive, that's health insurance. And just to put health insurance kind of in its place, and this is, it's like Costco. You pay a membership to Costco or to Sam's or whatever, and you can go and get 40 Snickers bars for $7. If you don't belong to Costco, you go to Quick Trip and you buy 40 Snickers bars for about $50. That's the difference. Health insurance is volume pricing, discounted pricing, and the networks, and that's just a really great way. Health care is what's delivered at hospitals, and this is according to me, but I firmly believe this. So putting that in that compartment, the Affordable Care Act. I think it's just a really good place to start with. Its true name is the Patient Protection and Affordable Care Act, also known as PPACA. The ACA is another way to look at it, but pretty much everybody knows it as Obamacare. It just is. I'll give you my opinion. I think it's fantastic for the individual. For companies, there's a few things, more hoops that they have to go through, but for the individual, it is fantastic. And this is where oops, there we go. Removal of pre-existing conditions. Before 2010, before 2013, in that space, an individual who had a pre-existing condition, be it high blood pressure, be it, whatever, any type of cancer, anything, they were going to be locked out. They were going to be locked out of being able to get insurance, of getting that discounted rate, that better pricing in a hospital. They just were. Or they were going to be, absolutely price gouged. If you had just high blood pressure, and I'm one of those people, so I would have been locked out if I went and got my own individual plan instead of an employer. So remove pre-existing conditions. Now anybody with any type of medical history can go and get an individual insurance plan. Prohibiting rescinding a policy, it did this. So what that means is if I had in the past lied on my application for insurance and said, nope, no high blood pressure, totally fine, and they gave me a policy, and then one of the first things I did was fill a prescription for high blood pressure, or if some medical tests came back and they found out that I knew that I had high blood pressure years ago, they could cancel my policy and keep the premium. They would have been, you lied, get out. What this does, what the ACA did, is it said, you know what? You make a mistake, you make a mistake. They're not going to cancel your policy. What they will do is just, say, this is what we would have priced it at had we known all the details, all the facts, but we're not canceling it. So that was a huge win. Free preventive care, speaking of huge wins, even with health insurance, back before this all took place, if I needed to go get an annual physical, a mammogram, or a colonoscopy, because who doesn't want that, even a flu shot, I would have had to have paid a copay. I would have been paying probably $60 out of my pocket just to go and get my annual physical. Those are all gone. It is now 100% at no cost to the individual to get preventive care. So there's no reason to not get a colonoscopy. There's lots of reasons to not get a colonoscopy. Elimination of lifetime maximums. Used to be that everybody who had an insurance policy, basically, the insurance companies would say, we got you, we'll take care of you to $1 million over your entire life, but you're never going to spend that. Fact of the matter is, a lot of people hit $1 million. You have a baby that ends up in the NICU, and basically the little compartments for small children that are born sick. That's $1 million right there. So that's going to hit it. You have cancers that you treat for long periods of time. That's going to hit it. So what it did was it said, nope, can't be locked out anymore. You hit $1 million, fine. You hit $2 million, fine. There's no more. They just eliminated lifetime max. Extending coverage to dependents, age 26. Those people who, it used to be that you could continue on your parents' plan as long as you were in college. A lot of people don't want to go to college. Then they couldn't be on their parents' plan. So at age 18, they weren't insured. And then, usually they just decided that 26 was the right number. Around 26, people started getting individual policies, or they started getting, insurance through their employer. But that 18 to 26 was uninsured. What this said was, hey, insurance companies, regardless of if they have a job, regardless of if they're married, if they're your dependent and you want to cover them up to age 26, go for it. So that was another win. Accountability for insurance rate hikes. You have always heard about it. It's like, oh, well, I had one procedure and then the next year they raised my insurance rates by 27%. It's now completely unaffordable. I can't do this anymore. They can't do that without a lot of hoops to jump through, a lot of paperwork, and a lot of justification. So insurance rate hikes for the next year, they can't raise it any more than 9% without having to explain why, without the insurance company having to be held accountable. So if they give a 10%, 11%, 27%, that's going to be filed with the government as to why they did that. So since I think I saw, it was like last week, that for 2014, the average rate hike was 7%. So they've held it lower. Another piece on that was a big win is insurance companies now have to give, they take in premium. They have to use 85% of that premium dollar to better their networks, to pay out claims, to advance health care, to pay doctors for doing better quality of care. They have to use all of that money for health care. The other end of it, they have to keep all of their administrative expenses, salaries, and all of that kind of stuff. They have to keep that at 8%. If they go over it, if they get into the 10, the 12, the 20%, they actually have to refund that money back to the policyholder. So Aetna got in a lot of trouble right off the bat when they instituted this, and I think that they had something like a 20% administrative when it was supposed to be under 10. And they ended up having to go to every single policyholder and say, here's what we owe you back. We couldn't keep it under control. So now that doesn't happen anymore. They're now all holding their administrative expenses to where they need to be. Payment for quality. So just real quick, doesn't that sound obvious? Payment for quality? It sounds obvious. Medicare. So Medicare is the largest insurance group in the country. Medicare takes care of everybody over the age of 65, or if you have a couple different conditions prior to that. So Medicare takes care of a huge population. They get the doctors that do the treatment, they get reimbursed by the federal government. And the federal government has said, look, we're still going to reimburse you your rates for treating Medicare people, so anybody over the age 65, we're going to pay you. But we're going to pay you more if your quality's better. So that started, and it's just become this huge kind of trickle down, but a lot faster, because now major insurance companies, major hospitals are actually starting to pay their physicians better for actually doing a better job. So it seems obvious, but it's now law. Then there was the creation, this is what I'll get into, this is what a lot of people think of as the ACA. The health insurance marketplaces. Exchanges were created and subsidies. The exchanges are where you can go to healthcare.gov and you can say, I want to get my own individual plan, and it's basically the Expedia, or Travelocity for health insurance. The subsidies are where the government said, if you make between this much or this much, we're going to give you some money to help offset your premium. We'll pick up the tab so that it's a little bit more affordable. And I'll obviously get into that. Not in the least bit exhaustive. There is so much more in there, but that's just really kind of the quick high-level stuff. All right. I'm going to use some industry jargon. I just want to, I hope this, to me it seems right on, but I've also been doing this for 10 years. Medical premium, because I'm going to be using these phrases a lot. Medical premium is what you pay every month for your medical insurance. It's kind of like, your insurance for your house, your insurance for your car. That's the premium, that's the check you write. Deductible. Deductible is the amount, if you have a medical plan that says you got to pay $5,000 before we kick in anything, like that's a deductible. So that's what that is. Money you got to pay out of pocket. Out-of-pocket maximum, whoa, I just jumped ahead. Out-of-pocket maximum, that's the maximum amount that you will have to spend in a calendar year for your health insurance. It's your deductible, it's a little bit more, and then after you hit that, you're done. I've got examples of it. And then copay. Any time that you go and access health care, outside of that out-of-pocket maximum, that's not preventive, so this isn't your annual physical, this isn't your fun colonoscopy. If you have to go in for, it's like I'm sick, I don't feel well, I really want to see the doctor, you're going to pay like roughly $60, $30, whatever your plan is. That's the copay. So I've got some examples to sort of bring this in as well, but just wanted to start off with the jargon. All right, so health insurance marketplace. Obamacare, I hate to say it's because it's ACA, but people know it that way. Basically, they established 4 types of plans. You can have the precious metals. You can have the bronze, you can have the silver, you can have the gold, or the platinum. And here's just an example of them. But basically, if you look just where it says premium on the dollar sign, your bronze plan, it's not going to cost you a lot, but it's going to not pay out a lot. It's not going to have a really, really rich benefit. If you go all the way and you buy a platinum plan, that's going to cost you a lot every month, but it's going to have a much richer benefit. So, for example, on the bronze plan, the deductible is going to be $5,000, which means your preventive, all of the preventive stuff, that's free to the person. You don't have to pay for that because it's on the house. You have this, go for it. Other things, x-rays and diagnostics and things like that that live outside of a preventive exam, that's what's going to need to be paid for. If it's $3,000, still have to pay the $3,000. But when you hit $5,001, that $1 is when the insurance company starts paying. And they're going to pay, depending on your plan, they're probably going to pay about 70% of whatever it is. So if someone has a $10,000 bill, the first $5,000 is on them, and then after that, the insurance company starts paying. So out-of-pocket maximum, that is roughly 30% of your deductible, give or take. But what that is it's $1,350 more that you would have to pay. So when the insurance company, you've already hit your $5,000 deductible, insurance starts kicking in, they're paying 70% of whatever, and you're paying 30%. So once that dollar amount gets to an additional $1,350, your out-of-pocket maximum is full. So to give you an example, 2 years ago, my wife and I had and this bronze plan is what I have currently for my insurance. It's through my company, but that's my plan. Not a very rich benefit. So when we had our daughter was $7,000. We burned through our out-of-pocket maximum. And I was like, you know what? I've needed to have a couple of tests run for a while, but I've not been doing it. Now, I'm not going to have to pay anything. I'm already paying my insurance. I'm going to go get this stuff done. So I went and did that. The office visit copays for a bronze plan are going to be at $60, and for hospitalization, the individual with the bronze plan is going to have to pay 30% of that hospitalization, up to their out-of-pocket max. So, for example, if you're in the hospital for 5 days and your bill is $70,000, the individual would have to pay 30% of that bill up to their max. To look at it on the other end of the spectrum, a platinum plan, it's going to cost more, but there's no deductible. You don't have to meet anything. The insurance company is going to start paying their percent of it. Usually it's 80% of the bill. They're going to start paying right away. The out-of-pocket maximum is going to be lower for that individual. If they hit $4,000, great. They're not going to have to pay the 20% that they were. They're done for the year. The office visit copays are a whole lot less. And going back to that example of you're in the hospital for a week and you've got a $70,000 bill, individual with a platinum plan is only going to be spending $250 a day, as opposed to that percentage. So that's the spectrum. The reason why these are a little bit different, so on a gold plan, there's no deductible. You've got that high out-of-pocket max, but the benefits are a little bit richer than over here. And then for a silver plan where you pay a little bit more than the bronze, deductible's lower, your out-of-pocket maximum is lower, but it's still, you still have that deductible. So looking at that, yep.
What determines the
Premium is, it's a great question. Age, gender, health risks, things like that. I'll show you an example of another piece up here. But usually it's just to start it off with, it's age and gender. Men, when they're younger, they don't cost insurance companies very much. Men, when they're older, cost insurance a lot. Women, when they're younger, cost insurance companies a lot more. When they're older, they don't trigger the services that often. So what the ACA did, and this is lots, if you wanted to do a find number of times in the whole document that the word qualifying is in there, it's going to be way over 1,000. But qualifying, the government said we have to have a line in the sand that says this is a plan that people will get a benefit out of, and this isn't. So where is that line in the sand? Line in the sand is on the bronze plan. So by law, it basically says if you're going to put insurance companies and exchanges, if you're going to put a plan out there, it's got to meet these minimums. And it's, for the most part, this is not verbatim, but this is close. There might be a slightly higher out-of-pocket maximum. This might be 35%. But they basically said we got to give somebody that says this is qualifying coverage, as opposed to just something out there that has no value whatsoever. So the bronze plan, anything to the right of the bronze plan is just a better benefit. So the next piece, qualifying was a big word. The next word is affordable. I mean, it's in the title, the Affordable Care Act. So what makes something affordable? This is really busy, so give me a second to walk through it. Affordable means for everybody, really. And there's it's called the federal poverty level, which is slightly lower than $11,770 per year for a single individual. So what it is it said we will pay part of your premium depending on how much you make, we the government. So anybody that makes 100% of the federal poverty level at $11,770 a year, anybody who makes between that and $47,000 a year, that's 400% of the poverty level. So anybody that's in this spectrum, the government's going to kick something in on the medical premium. So for an individual that makes just less than $1,000 a month, government has money in there for them. Anybody that makes slightly lower than $4,000 a month, the government has money to help offset the premium. Anybody that makes below the federal poverty level, anybody that makes below that 100%, they actually are eligible for Medicaid. Medicaid is an insurance plan that's based on your income, only for people that are below, to the left of that 11,770. For a family of four, to spell it a little differently, $24,000 a year or $2,000 a month for a family of four, all the way over to just shy of $100,000 a year or $8,000 a month. The government has some subsidies that they're going to kick in. It's called subsidies, which basically they're going to help you with your premium. That second bullet says paid in advance. The way it goes is when you sign up for a health exchange or for a plan on the healthcare.gov, it's going to ask you, how much do you make? What was your W-2? And you type that in, and then it's going to calculate based on that, based on your premium, here's how much money we're going to give you to help offset it. My next slide illustrates that. Yes?
Just on the one right that showed that the silver maximum was right there, the 2250. And then gold is more. How does that make sense?
Yep, great question. This has a deductible. The insurance company will not pay anything until you meet that $2,000 deductible. On the gold plan, there is no deductible. Great question. Great question. Okay, so all of this information is based on the 2015 government data from Medicaid. Does not include Alaska and Hawaii. That's my disclaimer on that. Those have much different. But anyway, so this is where that is. You can go out to Medicaid.gov, find out whatever information you want on it based on a family of whatever size, 1, 2, 8. So this is a tool that is, I've got it written down on I've got this animation that comes up. But anyway, this is a tool you can go out online and use. I did it that said, okay, I'm going for the state of Missouri, 2 adults in their low 40s, and 1 kid, they make $60,000. Calculate the subsidy that I would receive. So it rolled out, this automatically defaults to a silver plan, not the bronze, not the gold or the platinum, but that silver plan. And it would say, okay, for 2 adults over the age of 40 and a 2-year-old, your medical premium would be $700. However, because you fall between that 100 and 400, $60,000 is right at about 300% of poverty level, I'd be eligible for a subsidy. So there would be my monthly premium cost. However, the government's going to kick in $230 because of the income that I told them that I make. And my new premium for 2 adults and 1 child is $475 a month. Now, beware of tax time surprise. All of this is paid in advance. If you say I make $60,000, but in the end you actually make $80,000, the government will ask for that money back, and they're going to ask it for you on your next year's tax return. If you were expecting a big return, but yet what was told at the very last year isn't right, they're going to pull that money out. Also, if you end up not making as much money as you said, they're going to put some more in and say, you know what, we actually should have given you a little bit more for your medical premium last year. But they do this on a monthly basis. It's just a great way to get that immediate discount for your monthly health insurance. But this is real, and I know people who said, I went through, I got it, I got my tax return. There was no return. In fact, I actually owed $1,000 more because I didn't put down exactly what I was making. So all of this, I knew I had it. You can go to Healthcare Marketplace, which is a website, and just run your own subsidy calculator if you want to do that ballpark. While Healthcare Marketplace is not a government run website, it's pretty close. You just can't go 100% in. So with that, since half of the audience is sleeping, I'm kidding. Here's what you need to know. Here's really what you need to know for 2016. November 1st, the door is open to go in and get coverage if you want. Right now, coverage is closed unless you have, unless you lose coverage right now. There's some qualifying events, but for the most part, if you're thinking of insurance in 2016 and for the Affordable Care Act, by law, you have to have insurance for 2016. You, November 1st, can go out to healthcare.gov and start finding the plan that fits for you, or renew your plan or change your old plan. Second date to look for is December 15th. If you want your coverage to begin on January 1 of 2016, you have to enroll between December 1st and December 15th. So you got a month and a half to get that done. It just needs to happen. If you do it after December 16th, your coverage more than likely is not going to start until February. So that means that you would be deemed uninsured for the month of January. So it's get in and get it done. And then January 31st of 2016, that's the last day to even apply for health insurance for all of 2016. The open enrollment only lasts from November 1st to January 31st. So that's, and then after that, you'd have to find insurance somewhere else, but not through the ACA exchanges. All right, that's the Affordable Care Act. Now it's on to kind of some interesting stuff, in my opinion. Actually, it's all interesting, in my opinion. Tools, tips, and tricks. There's health insurance, and then there's not health insurance. And one of the things is how to just do it financially better. The best place to start is urgent care versus ER. In my opinion, I think the only time you should really go to the ER is when you have to be taken in an ambulance. When you have a wound to the head that's not going to stop, when you have seizures that are not stopping. The emergency room is really a place for emergencies. An urgent care center is a place that will pretty much take care of everything else. This was just a quick Google search using the zip code for right here on the different places within, I think it's a 30-mile radius, of all the different urgent care centers. There were 23, everywhere from Parkville, Liberty, to Lee Summit. I strongly recommend going and just doing that Google search for wherever you work or wherever you live and finding the one that's closest to you. Because if you go to an urgent care, as opposed to going to an ER, you can pretty much drop a zero off the bill. In an ER, they're gonna run every single test on you because they need to. It's expensive. It's also a very long time to wait in line. The average wait is anywhere from 4 to 6 hours to get seen, unless it's really a true emergency, then they'll get you in. But in urgent care, I would say 90% of them are open 24 hours a day. A lot of them treat kids. So if you have children, urgent care all day. It's just much cheaper and less of a wait. The next tip is if you have prescriptions, if you're on prescription medication, this is a fantastic resource. It's a company, it's called GoodRx. I couldn't figure out exactly how to, I'm gonna do an example of it right now. I couldn't figure exactly how to do it with, let's see, let's go down. So I just brought it up online. Perfect, okay. Pharmaceuticals, they cost a lot of money. The thing is that the same pharmaceutical does not cost the same at location 1 to the location that's right across the street. So what this does, just as an example, I'm gonna use a drug called simvastatin. Simvastatin is used to treat high cholesterol, and it's generic. If you have the option, always go generic. There's really no difference. Very few people have reactions to a generic versus a brand name. So using this example, I just went in, typed in simvastatin, click on it. This brought up, am I still in? Nope. Use this zip code again. And what you can see is for this pill, it has the image, so you make sure you're looking at the right thing. You could do your right dosage. But at Target, this drug is gonna cost you almost $6. If you go to Walgreens, it's gonna cost you almost $11. Here you can say, you know what, there's a Target right by my house, I wanna get this, let me click on here, I have a free coupon I can print off, or you can just have it on your phone and they can scan it when you go there. But this covers pretty much 99% of all the drugs that an individual would ever take. Specialty pharmacy, you name it. It's just a great way. And then if you do need to have the brand name, if a generic does not agree with you, then you can just go over here and say, you know what, I need the brand name. It's still gonna help you out. CVS, it's gonna cost you $228. Walmart, it's gonna cost you at Walgreens, it's going to cost you $250. So again, I can't urge you enough to and all of these dollar amounts are without insurance. So insurance is just going to be better. So if I haven't convinced you that this is a great tool, then you should take generics. I don't know what else I can do. Lastly on here, wellness. There are things that wellness won't do. Wellness won't prevent a brain tumor. Wellness won't prevent leukemia. Wellness won't prevent a ruptured appendix. It just won't. But it can do a whole lot beyond that. And what I mean, so here's just a couple examples. There's a video, so this presentation is going to be put on the website somewhere. This is a link to a video that's on YouTube. It's called 23 and a half hours. If you do nothing, just watch the first 4 minutes of it. It's 9 minutes long, so just watch the first half of it. And basically what it says is, if you can get everything done in your life in 23 and a half hours for one day, if you can get job, kids, family, food, groceries, cocktails, whatever. If you can get sleep, if you can get all that done in 23 and a half hours, that's going to leave 30 minutes for physical activity. And walking has proven to be probably the most effective medical treatment out there for so many different things. And it's 30 minutes of physical activity a day. And it doesn't have to be a solid 30. It can be 10 minutes here, 10 minutes there, 10 minutes there. Walking around the block, wherever. It's huge because it just starts getting your body moving. One of the things, and I know that sounded incredibly obvious, one of the things that really has helped is activity trackers. I personally wear one called a Fitbit. If you go to Target or Best Buy or wherever you go, there's going to be aisles of these things. They're huge, and they track your steps. It's so stupid that I went and bought a device that simply tells me how many times I put my left foot in front of my right foot. But the thing is that I wanted to have a goal of getting 10,000 steps a day. And it makes it a social thing. It syncs to my phone. But you don't have to spend money either. You don't have to buy a device. If you have a smartphone, there's free things out there. One called Map My Fitness, another one called My Fit. That was misspelled. No, that's right. MyFitnessPal, and then Runkeeper. Those are all 3 free apps. You just have your phone with you. You keep it in your pocket. It's going to track the number of steps. But if you can get 10,000, that's awesome. And quite frankly, for those people that move around a lot on stage or load in and load out, I would love to know that how many steps just get done in that window. Lastly, from a wellness standpoint, knowing your numbers. A lot of people don't know their blood pressure, they don't know their cholesterol, they don't know their glucose. Glucose is basically the number that says how much sugar is in your bloodstream, and lets you know, it's a precursor for diabetes, basically. If you have really high glucose, you might want to work on changing that. But it doesn't take going to a physician's office to get those numbers. You can go to CVS, you can go to Walgreens. It's probably one of the best investments, in my mind, that an individual can make, is just knowing where they are. I got into wellness over 10 years ago because I worked for a company that had nurses come on site and do blood pressure screenings. And a nurse looked at me and scared the shit out of me, saying, "You are way too young to have blood pressure that high." I was like, I had no idea. Because it's what's known as asymptomatic. You can't feel high blood pressure, you can't feel high cholesterol, you can't feel glucose until you end up in the ER. And then they tell you, you have high blood pressure and high glucose, and now you have diabetes because you never did anything about it. So knowing those things, I don't say that for a scary effect, I just think it's fantastic if you can find out where you stand. The last 2 things, because it's right before lunch, your stomach, believe it or not, is the size of your fist. And if you think about, I know that I violated this rule last night, but your stomach is the size of your fist, sits right here, and when you go out to dinner, you probably eat a whole lot more than the size of your fist. And because I absolutely did that last night. Here's the other thing. It takes 20 minutes for your stomach to tell your brain that it's full. So this is like a really bad joke that our bodies play on us. You know, you eat a sandwich that's like this, so a couple of fistfuls, jokes all around. So you have a sandwich like that, and you eat it in probably, I would say, 7 minutes. That's why right after dinner, not during dinner, but right after dinner, you're like, I am so uncomfortable. I'm sleepy, because your body doesn't know what to do with it. So your body's like, all right, everything go to fat. Get out. You're all fat. Because it can only process as much as it can process. So it's slowing down, its portion size. Just wanted to give you that little nugget before lunch. But yeah, stomach's the size of your fist, and we all eat in about 7 minutes, so your body's not gonna know, or your brain's not gonna know. With that, thank you very much. This has been awesome, and I hope that there's any information that was of use. And if there's any questions, I'm more than happy to. Yes?
Can you explain penalties for not doing this?
Yep. It's roughly 1% of your income up to right around $1,000. Yep. So when you file your taxes, I think it's like the second question on the form now. It says, did you have qualifying coverage for the previous year? And if you put down no, then it's all right, and it's automatically going to take that money out in your calculation. If they're below the poverty level.
If I convince them to file their taxes and they're below the poverty level, and they would have been eligible for Medicaid. Okay, so say they would have been eligible for Medicaid, are they going to be penalized for not utilizing it?
No. To my knowledge, no. Because
I don't even now telling me I'm not filing my taxes because I'm going to have to pay something. I just want to be able to tell them, no, you won't if you're under this, if you're under
Right.
the poverty.
If they were below the federal poverty level and they were eligible for Medicaid, so they really should have been on Medicaid.
Right, but they don't, they weren't sick that year, so they didn't.
They just-
Medicaid, they didn't, whatever.
They just didn't.
Right, so.
You know what?
Penalized for just not even being on something they would have used, that would have been free.
Let me use that as a follow-up. I'm 99% sure the answer is no, they're not going to have a penalty because they'll be in that economic bracket that just gets away from that. But I'm not 100%, so let me filter that answer to Scott, and I'll get that to you within just a couple days.
Thank you.
Yeah.
Just talk for a second about the states and the state differences when it comes to healthcare and marketplace.
Yep. So some of the states, the whole idea was that the states would run their own insurance programs. They'd run their own exchanges. Kansas would have theirs, and people in Kansas would, go through the insurance companies there and give the premium to the state, and the state would pay the money, and then the state would go back to the federal government and said, look at all the money we paid, reimburse us and give us 2%, give us a kicker. But there were a lot of people that represented those states that said, we don't want this. We don't want this hassle. You do it. You do it, federal government. So some states run their own. Other states have the federal government do it themselves. So here's where the differences come in. Not every state has Humana. Not every state has Blue Cross. Not every state has Coventry. So there would be a different carrier for each state, or different carriers to choose from for each state. But those benefits still have to all be, where the hell did it go? Nope. Yeah, they're all going to look they're all going to be somewhere in here. There's going to be some different nuances. Like there might be a couple different types of silver plans. Like one, the deductible might be 22.5, and the out-of-pocket maximum is 2,500. They'll be built a little bit different, but for the most part, they're all going to have to be in here, and every single one of them is going to have that as the minimum. So.
Is the process for signing up different?
No, if you filter everything through healthcare.gov, it's going to get you to the right place. So for California, there's Covered California, that you can just type in Covered California and go to that. But if I went to healthcare.gov and typed in California, it would route me to the Covered California website. Yes?
If you're below poverty level, and but you have some financial assets, Medicaid is out.
So that's a different conversation.
Oh, it is?
Yeah.
That's if you're doing like long-term taxes.
Yep.
Then that's where you're gonna get.
Right. So.
If you just have a big ass nice boat, they don't care.
Yeah. It's.
You pay your property taxes on it, they don't care.
Yeah. So qualifying for Medicaid. What they'll do is they will really do a deep dive into what you have to make sure that, because there were a lot of individuals who were wealthy that said, I want to get in on Medicaid. And so they would give all of their assets to their children and say, hang on to this for me. So that on paper, they looked really, really low wage. Right. And so Medicaid said, well, wait a second, we're actually starting to get a lot of people that we don't think this is right. So they have what's known as a look back period. So they'll look back, and I believe it's 5 years, to go back and say, okay, last year you were really wealthy, and this year you have no cash whatsoever. What happened? What happened to your boat, your house, all of that stuff? So I don't want to be over my skis. I don't want to tell you the wrong thing. I can find out some more information on the Medicaid piece. All right. Yes, so forced to use COBRA COBRA, just to level set it, when you have insurance with your employer and then you leave your employer, they have to offer you what's known as COBRA, so coordination benefits, blah, blah, blah. Basically means you still can have their insurance plan. The thing is that now you have to pay the full premium. A lot of employers will pay 70–80% of the premium, so that the individual is paying out of their paycheck about 20 to 30%. And so when a person goes on COBRA, they actually pay 100% of that premium, but they still are offered coverage. And that coverage goes, I want to say, 2 years, so about 24 months is the longest that they can be on that plan. So the individual has to write that plan all the time, or write that premium all the time. You can drop COBRA anytime. You just have to fill out some paperwork that says, I no longer want to do this plan. I'm terminating my coverage, and I'm not going to be paying my premium, and it's like, okay. So from that, is your question more about, do you have to have insurance after that, or what else can I tell you on that?
I'm sorry?
What more can I tell you on the COBRA piece? Okay, yep. So that's how that works. Exactly. Exactly. Or if you get a job with a company that already provides health insurance, you can go and get on their plan then, and you don't have to pay COBRA. You never have to pay COBRA. It's just when you leave your employer, you're no longer insured until you have insurance next time. So COBRA is just a way to offer up insurance benefits, the same that you had with your previous employer. Yes?
Do you have any idea what is the biggest factor that stops people from enrolling in ACA, or what is it that's keeping people?
Opinion, not fact, is the whole thing of, I'm healthy now, so why bother? Or, I was sick last year just a couple times, and I paid maybe a total of $1,200. Why would I spend money for a medical premium that's expensive? Because it is. Why would I spend money for a medical premium that's expensive, that even the lowest price option I can get out there, I still am on the hook for $5,000 before anything? And so it's using that of either I can't afford it, I'm not sick, or even if I have it, it's going to be useless. And I would argue a couple different points. One, like, yes, in your mind that sounds right. Or in my mind, it sounds like, well, why would you buy it? It's that what if. It's that catastrophic. You buy the bronze plan for the what if. Because it's going to protect you up to that number for that year. And it's just going to, it will help. It's still going to be expensive. But if the government subsidies can help offset that premium, and it'll help. Another thing is the free preventive exam. Like, that's huge. And if you're a woman, there's also free, depending on the state that you live in, and the coverage that you have, that's my disclaimer, there's free contraception. So, there's a lot of things built in that make it worthwhile. That annual physical, I just think, is huge. That was a huge win. So that would be it. It all stems around financial.
People tell me the only raise, I had a $500,000 raise for free when I was 36 years old. With no insurance, $48,000.
Yep.
$480,000.
Good God. So, what do they say after that? They're like, oh.
Well, hospitals, I mean, really, seriously, I was a sailor from Cleveland, and I mean, when they realized that I didn't have any insurance, they had somebody in my room talking to my husband. I mean, I was being for surgery, and they were saying, do not stress about this. This isn't typical. We're going to take care of this.
Yep.
And it did end up, I was on Medicaid for a year for all my grandfather.
Mm-hmm.
I wasn't supposed to be okay. So they were, I'm not supposed to be sitting here. So I was going to have to, I mean, they were prepared for me to be on Medicaid for the rest of my life.
Mm-hmm.
But then they were like, oh, we don't know. You can't have this anymore. You can drive a car and you can do all these moral things. So get out, leave. So I don't have a CAT scan now that I should have.
Got it.
Once a year, because I can't afford to pay $2,000 for a CAT scan every year, but they did cover the
Mm-hmm.
surgery.
Mm-hmm.
And by the way, $230,000 of that was pharmaceutical. That's how I got control of pharmaceutical drugs.
Yeah, that's a.
$250,000 in pharmaceuticals.
Yeah, anybody wants to go drinking sometime, we can talk about that. Sure, of course they're great. The pharmaceuticals, come on. Yeah, no, I'm with you. There was a law that was passed. Probably, I think it's like 15, 20 years ago. It was called EMTALA. I'm over, and this is just a story. But it's the Emergency Medical Treatment Act, and it basically means that anybody that shows up to an emergency room must be seen, regardless of their ability to pay. Used to not be that way. It used to be, can you pay for this? Nope, off you go. So the hospital is by law required to stabilize the individual, and once they're stabilized, then they can be moved to a different hospital. We have friends that this has happened to where they went to one hospital and they said, all right, you're here, we'll stabilize you, but then we're transferring you. Yep. And they've got to move you, so by law. So that was a great thing. Unfortunately, one of the things is that it's done is it's also opened up the floodgates for people to use the emergency room as their primary care physician. And that's why I strongly go back and just recommend find the urgent care near you, because it's a whole lot cheaper than the emergency room. Just interesting. So.
There are a lot of people using the ACA instead of COBRA, and is going on the ACA actually more affordable, or does it end up being?
It is. It is. It's actually, it'll be a lot more because what you have on the Affordable Care Act, on that exchange, on those exchanges that you don't have on COBRA is the subsidy. It's you know, so if you're on COBRA and you make 500% of the federal poverty level, you know, maybe you should stay. But yeah, so if you're, you know, that subsidy really was a big win. And, you know, there was a thing that was released this morning or yesterday, but it was data that pretty much shows that the uninsured gap is drastically closing because of the Affordable Care Act, because people now have, when it's removed that pre-existing condition, it's made it more affordable. It's still expensive, but it's made it more affordable. All right, well, thank you very much. If thank you. There are a whole bunch of topics out there. This was just something that Scott and I were talking about on our Moonlit Drive. And I mean, it really is kind of funny because I was like, let's check out this place. You know, there's other topics out there. You know, I'd love to do this on, you know, maybe not fly out here, but maybe like live stream something or just record something on a quarterly or every 6 months type of thing, because this has been terrific. So thank you guys for having me out here.